Dr. Winter talks with the patient who was told she needed knee surgery, but found that that wasn't necessary.
A couple of years ago, actually, it was 2 years ago in May, I did something, twisted wrong, stepped wrong. Anyway, my knee really felt horrible, pulled something, popped something. I ended up going to an orthopedic doctor, and they said that I had a partially torn meniscus, and I had arthritis real bad in both knees, but the one knee was especially bad with the torn meniscus. And so, they had me do some exercises, and he said that, and it got somewhat better, but at the time too, I had been playing tennis a lot, and I think I maybe had tried to play tennis a little or thought I could go out, but I really couldn't do it. I was afraid to really push it with the tennis. But so last May we were getting ready to go on a big trip with some friends and go on a cruise and be in the Mediterranean. And I knew we were going to be in Athens climbing the Acropolis and Rome and doing all sorts of climbing and lots of stairs. And I was really concerned because my knee it was still bothering me quite a bit. And especially if I tried to do anything special like that, it would just swell up and get really sore. And the orthopedic doctor had said, well, you're going to be wanting to come back in probably eventually for knee replacement. And I'd heard about people getting shots in their knees. In fact, I think I decided, Mindy had heard about Winter Wellness, and she told me, what you all did, and said, Mom, you might as well give it a try. It can't hurt. And this was, I think, about a month before we were going to leave on our trip. And so I came in to see you, and I remember saying, okay, you've got a month to get me in shape. And we laughed and didn't know whether, and I told you at one point, I think it was, at that point even, I said, I may have been that I had found out, I could get a steroid shot or whatever up to a certain point I thought I would wait until, I think what it was, a week or two before the trip, where it was supposed to have time to take effect, but not too soon, not too late. So I made an appointment to get a shot, but I really didn't want to do it. And I thought, well, I'm going to give this a try. And so I came in, and you started working on my knee. And I think for that month, I came in at least 3 times a week. And I tried to, really do it 3 or 4 times a week and give it a shot. And by the time it got close to where I was had to make the decision about getting a shot or not, I really felt like it was getting, enough better that I was going to just risk it and try it without it. And by the time we left, it was doing a whole lot better. We went on that trip, and I couldn't believe it. I thought, oh, well, when we get to Athens and they start climbing the Acropolis, I would probably end up saying, oh, I'll be sitting here at the bottom waiting for you when you come back. But when that came to that day, and we were there, and we were starting to climb, it's steep, and then lots of stairs, and I did fine that day, and we did so much walking and climbing, we were gone for almost a month, and we did museums in Florence, Italy, where we climbed hundreds of steps, and we did a big hike along the Italian coast, the Cinque Terre area, which we hiked for, I forget now how many miles it was, up along the cliffs. And the whole trip was so amazing, and I was just every day. The friends we were with, they kept saying they thought I was going to be the one holding everybody back. Instead, I was doing better than all of them, and I wasn't really that sore. I never had another thought about needing a knee replacement anytime in the future. So we will see. I'm 70 now, and I expect my knees to hold up for another 20 years at least.
If you were told you need a knee replacement, reconsider. Call Dr. Winter at 770-536-6600.